Hi, Dr. Joe Albano, Sammy Spine here. Today we're going to be talking about lower back pain treatment. So, what is the best thing to do when you have low back pain? First, if you're in acute pain, you want to try to avoid anything that's going to aggravate it. And if you've had back pain, and I assume you have if you're looking at this video, and I have too, it's not so much fun, and you just really want to do whatever you can to minimize it. So one thing you can do is get off your feet, and you could lay down on your back and get your, so I'm on the floor then, assume I'm on the floor, get your hips to 90 degrees and your knees to 90 degrees and put like your legs on a chair or something like that. And a lot of times just that position can help you a lot. People like to take anti-inflammatory medications like Motrin and Aleve, things like that. I hate those just in general because, one, they have significant side effects potentially. Like it can lead to ulcers in your esophagus, your stomach, your small intestine as well. You can get bleeds from that. When I was working in hospitals back in the day, we'd see people come in with these ulcers in these places, and they're in the intensive care unit and not doing so well. So there's that. There's also cardiovascular bad effects you can get from these. So not my favorite, but they are really good for pain relief. That's why people do them, because it works. It seems to be that acetaminophen or Tylenol doesn't work quite as well for most people, but you can try that too. Also not without bad side effects. That one is if you're taking too much, you can destroy your liver. I've seen people in the ICU with that as well. So just make sure if you're going to take these medications, take them under the advised amount and don't ever exceed it. So medications, there's two of them. There's prescription medications, of course, that you can get from your doctor, but they're not getting at the root of the problem. There's like, say, muscle relaxants, for instance. Some people really like those. They just don't do that much to really relax the muscle. Kind of makes you feel spacey in the head if you've ever had those things. And it just, it can help you maybe sleep, but it's not fixing the problem either. Then there's narcotics. Obviously, it's kind of a big deal to take narcotics for pain, especially if it's a chronic pain. You don't really want to be doing that because you have the risk of getting tolerant to these developing a tolerance to these medications, and then you can become addicted to it as well. So we medical people try and hang on tight to these prescriptions nowadays, and they are pretty good. They're narcotics. They do work for pain. We give them for acute pain all the time for different things like post-injections or post-surgical. If you have a fracture or something like that, yeah, you're going to get narcotics, but you don't want to be on them for that long a time. Other modalities, you can use ice. I really like ice. 15 minutes on, 45 minutes off can really help a lot with the pain. Some people can't tolerate ice and they need heat then. And heat's okay too. Better to do heat followed by ice. If you do heat, it's about 10 minutes is what I would recommend max, and then follow it by ice if you can. Big mistake people will make is the hot tub. So see if you know about this. You hurt your back, you go in the hot tub, you're like, this is really good. Feels so good in the hot tub, and you stay in there for about an hour and you get out and it's so much worse. Don't do that. If you're gonna go in a hot tub, 10, maybe 15 minutes max, and then get your bum out of there, because you will regret it later on down the road. Seen that lots of times. Other treatments, you can do acupuncture, that's good. Massage is good. Physical therapy is very good. Lots of different techniques that can be used there to help, and I definitely recommend that physical therapy be one of those things if you have back pain, acute or chronic, and it just helps strengthen up your core muscles in here in your back and your glutes. You also need to stretch your quads and hamstrings because those can be problematic as well. You could have some muscle imbalance there. Physical therapy can help figure that out. I see a lot of people in here that have glute problems, meaning weakness, and that just goes along with back pain, but it needs to be addressed as well. And then other treatments, when you get to the doctor, we can use these regenerative treatments on you. We can use your blood, your fat, your bone marrow to help create a healing inflammatory reaction. And we have another video on that one. So hopefully this helped you about lower back pain treatment questions and answers. And I'm Dr. Joe Albano, and we hope you live better without surgery.